Good morning and welcome to Facebook Live. We are trying something different today. I'm sharing my screen and I sure hope this is working. I tested it before earlier this morning and it looked like it was working like a charm. So today we are talking about finding and using your voice. So, how to be seen and heard as a family caregiver. So, our healthcare system works well if you're experiencing an acute situation like you've broken your arm or you've had, an event like a heart attack. It becomes a little more complicated when you have to manage multiple conditions, dementia, mental illness. And so, individuals who are living with complex chronic conditions often move across different care settings or healthcare settings. And then this usually means that they require the support of various healthcare professionals. They might have to be tapping into community based services through the health authority. And so what happens is, so that can include things like case managers, pharmacists, specialty services. And then what happens is there ends up being, so many people a part of the care team, and there's a lot more to juggle. So, as we know, family caregivers are often the ones that are managing many aspects of the care, and they often know the care recipient better than the care team. And so, this is a key reason why family caregivers should be included in partners in care. As you can see on the slide, there's tons of areas where family caregivers are involved in care. And I do want to make note that I tweaked this slide from another presentation that was given by the Caregivers Association in Alberta. They did such a great job. We just sort of finagled a little bit to better reflect our organization. So, information that you give as part of the care team is really important and is dependable as many other parts of individuals on the care team. You are often the ones that are included in supporting the person who is receiving the care, and often you're the primary caregiver and you're responsible for implementing different parts of the care plan. uh, you're typically the one that's continuous along the spectrum of that care recipient's illness, and you can really help support by providing information with various assessments or medical appointments. So what the research shows us, and we're not going to get into too much in this morning because we have a short period of time, is that here's what family caregivers want as partners in care. They want to be recognized. They want to be recognized as a part of a key role in the care recipient's life and support system. They want to be recognized for the support that they are providing and the care they're providing. They want to be informed. So they want to really understand how they can support the individual they're caring for, but also information that's going to help them ensure that they are able to care in a way that is going to be best for the care recipient and best for themselves. They want to be included, and that's in care decisions and planning, in discharge planning, various treatments. They want to be included when they're the ones that are providing the support for the person they're caring for. And they also want to be empowered. They want to be empowered to ensure that they're able to put their oxygen mask on first when caring for someone else, especially with chronic and complex health conditions. They want to feel empowered to speak up, to set limits, to set boundaries. That's what family caregivers want as an important care partner. So we uh, use this case study in our Flipbook, and it talks about Michelle and Jeff. And Jeff has suffered a brain injury, and it has left him with some challenges, both cognitively and physically. Michelle, his partner and caregiver, has been supporting Jeff in getting him to and from appointments and coordinating care, as well as providing emotional support. And Michelle was feeling a little bit frustrated because she wasn't always included in appointments and always couldn't, sort of get access to the information she needed to support Jeff. And so it really affected the way that she interacted with the healthcare team, as well as being a caregiver to Jeff. So, how do we find and use our voice as a partner in care? And it's really important that we talk about, or that we stress that it isn't just for the person you're caring for, it's actually for yourself. Well, there's four main things that we want to focus on today, and that is: one is identify your needs, two is know your limits and voice them, three is understanding and getting consent, and four is being prepared as a caregiver. So the first one is identifying your needs. And we have a saying, and I'm actually not even sure who quoted this, but if you've met one caregiver, you've met one caregiver. And what that means is that diversity is not a one size fit all. Caregivers need to know about what their own unique situations, needs, and goals and required supports are to support the person they're caring for. And so there are lots of great resources on our website that can help you. One of them that I wanted to point out is our caregiver support plan tool, and it's really a tool that helps you drill down to identify what your own needs are. And so, what if we go back to the conversation with Michelle in the case study, what she was saying is that she understood that there was some, when she sort of went through the exercise, she identified that she wants to know, well, how do I support my partner to be as independent as possible, within his capacity? And how do I ensure that he's getting the best possible care from his care team? And then the third one was about her own personal need, and that was, how do I keep myself afloat and not lose my own, self identity? And so that's a really important part of, being able to speak up and be seen and heard. And again, uh, as with the case with Michelle, it's really important to look at the needs for caregiving and also what your needs are for your well-being. I think the other important thing too is that it's not, I don't think many of us inherently know what it means to be a caregiver. And so sometimes, even when we're going through different transitions, maybe we've been caring for someone for a few years and some needs have changed, and all of a sudden we're in a different place along that trajectory. Sometimes we still don't know, what's available or what resources exist. And so that's, being able to ask for help or ask for, more guidance can really also help identify needs. The other thing that we've certainly noticed at Family Caregivers BC is that sometimes caregivers, we just need a little extra support or an ear to help them identify and prioritize their needs. And so sometimes caregivers like to do this on their own. Other times they have a trusted source, or they, can reach out to a caregiver support group, or can certainly reach into our caregiver support line. The next one is know your limits and voice them. So what we've seen from caregivers and what we've heard through our caregiver support line and at workshops and through our coaching sessions is that this is often one of the hardest areas for caregivers to voice. So it can be difficult to say no when there's a relationship and these perceived expectations, not to mention expectations from others. So that's often a really great challenging pieces. And so the things that are helpful is considering what you can and can't do as a caregiver. Because sometimes when you write down what you can and what you want to do, and then what you can't do, and that could be for a number of reasons, or what you prefer not to do, sometimes you can look at that list and then see if there's anything on that list that another resource could fill, or if you have a circle of care, if there's someone within that circle of care that could help support in some of those roles. it's also really good to explore, what we call the bookends of your personal caregiving. So, what are your limits? Uh, and that's going to be a range for some individuals, but understanding your range for your own self. And sometimes that comes back to, uh, how do you also look at your own well-being and some of your own behaviors in relation to caregiving, but also in relation to just you as a person and focusing on your overall well-being. It's really important to find a way to have conversations and be able to voice what your limits are, and that's to the person you're caring for, even to yourself, as well as to healthcare providers. And I guess the last point is that caregiving, as all of us know, is very dynamic. And so we can expect that there's going to be changes in our limits and boundaries. We also have a number of really great resources around boundary setting. Um, and so in Michelle's case, she understood or she was trying to establish her limits, and what she sort of identified for herself is that she wanted to be obviously an integral part of her husband's or her partner's care routine, and she also acknowledged that there was one or two things each day that she felt were really important for herself to do, and for her it was 5 minutes of meditation in the morning before anything happened, and at the end of the evening to be able to do some form of physical activity, and for her that was walking, and she really tried to identify that as her own needs as a caregiver, but also to know that that she expressed that to her partner to say this is my time, and this is where I'm not able to support as a role as a caregiver, and I'm just being myself as Michelle. So understanding and getting consent. So one of the key areas that we certainly and we don't know all the answers of course in this area, because it's a pretty complicated system in terms of understanding and getting to consent, but there are main acts for privacy and healthcare consent, and so generally there's two in Canada. And there's the Healthcare Consent Act, which was developed in 1994, and then there's the Privacy Personal Health Information Protection Act, that's PIPA, and that was in 2004. And really what that talks about is it's around healthcare consent and patient privacy. So patient consent is required to share access to their personal information. So a care recipient or a patient can consent for their caregiver to have access to their personal health information. This consent can range from access to actual health records to participating in discussions with the provider about the care recipient, giving and receiving information. But regardless of how a caregiver is involved, the person receiving care has to make their own treatment decisions. So care recipients, of course, and the caregiver can certainly have conversations and support, but at the end of the day, the care recipient is the one responsible for the healthcare decision. And so this gets tricky, of course, when we're dealing with individuals with complex uh, medical conditions, including mental health, illness, or dementia. And so this is where things get very complicated around getting consent, especially, and we can't get into that today, but that's an area to be mindful of, that it's not it's not completely black and white. The other reality is that there is no one way to get blanket consent. And so this understanding that you're likely going to have to repeat your story and your role, or ensure that you have copies of consent forms to bring you to various appointments. So all that to say that understanding and getting consent is a huge part of caregiving. but also understanding that there are different ways to get consent depending on which part of the healthcare system you're dealing with. So sort of understanding what that looks like is also going to be helpful for you to be able to be an active, um, uh, have an active voice in your role as a caregiver. So being prepared. Uh, we talk a little bit about this in some other presentations, our contingency planning one. But one of the key areas is preparing this medical history for the care recipient is really helpful. Uh, and also, writing down what you do, and can't do is also really clear in terms of what your role includes, how you're supporting the care recipient, what your limits are. Keeping this in a binder or a notebook is really helpful, in addition to having notes of, various appointments. Of course, online Google Documents are also a great way for people to stay organized, especially when there's different family members involved in care. Of course, anytime we're going into a healthcare appointment, being prepared for the appointment and thinking about questions ahead of time, taking notes, asking questions, clarifying that what you heard is, what you've written down is another great way, to be able to ensure there's continuity in care and follow-up. We've also found that it's really helpful when there's numerous people involved to ensure that you have a list of all the individuals involved on the care team. So that can be, family physicians, it can be specialists, it can be pharmacists, it can be case managers, it can be outreach, workers, etc. Occupational therapists, physiotherapists. So just having everyone's name and how to contact and what their role is, and even how they're currently helping, is often really a helpful document to have. So that brings us to the end of our Facebook Live, and we look forward to feedback. If you have any other comments or questions for future Facebook Lives, we're always happy to take a look at those in our comment section. And we also just want to remind you that there's plenty of resources at familycaregiversbc.ca, and you're always welcome to call our caregiver support line. It's free of charge. And you can see the number listed there, 1-877-520-3267. I hope you all have a wonderful rest of the month, and we'll see you back in May.